Alex Tursi. I am the full-time social media strategist at Fletcher Allen Healthcare. Where's the clicker? We are Vermont's academic medical center in partnership with the University of Vermont. We're based in Burlington, Vermont. We do serve patients, 1 million patients, in fact, throughout Vermont and also throughout northern New York State. And we're also partnering with Dartmouth-Hitchcock as well as a number of other community hospitals through accountable care organizations. We're also a completely social organization. We have really embraced social media as a tool not only for connecting with our patients, but also our community, our employees. So I'm very fortunate to work at a place that has really seen the potential in social media and also realize the great opportunity we have to explore these tools as ways to connect. So what I'll discuss with you today is, if I can get this to work, is how we are actually using social media as a vehicle for our wellness programming and our wellness communications and really helping people be healthy at the outset so that they don't have to worry about certain diseases later in life. So all stories start somewhere. This one actually starts with me. When I started working at Fletcher Allen a little over 2 years ago, I went through what was required, an annual physical exam, and also I decided to do an optional biometric screening. And what I found out during that was that I was 30 pounds overweight, which wasn't a huge surprise. I could realize that by looking in the mirror. But I also realized through the biometric screening that I was at risk for a number of different diseases potentially later in life, cardiovascular disease, stroke. So I walked out of orientation a little bit scared. I mean, your first day of work, you don't want to find out all these scary things about your own health. But also it was a wake-up call and an awakening to me. And it made me really ponder, you know, I live in Vermont. Vermont is one of the healthiest states in the nation, according to a number of different magazines, publications. You know, you walk down the street in Burlington, you see people running, biking, people are really into activity. So I wondered, am I an outlier or am I part of a growing trend in Vermont? What I realized was I'm not alone. Vermont's obesity rate is now 23%, and that's, as you can see, almost 25% increase since 1990. Furthermore, chronic disease is on the rise. Diabetes affects about 8.7% of Vermonters. Heart disease accounts for 24% of deaths, and 25% of Vermonters report having high blood pressure. And our leading causes of death are diseases of the heart, cancer, and stroke. Furthermore, risk factors are rising in our state, and what I think is really interesting about this chart is that if you look at the top of it, it looks at our youngest residents, our youngest Vermonters, high school students, and you can see even though we are below the national averages, we're not that far below, and these trends are growing if you look at them year over year. So you'll see we have overweight kids, kids eating fewer than 5 fruits and vegetables a day, not attending PE. And you can see as they, you know, age up into the adult population, they're experiencing a number of other different health issues. We're also in a really interesting point in time in Vermont. We are moving from a system of illness to one of wellness. What do I mean by that? So Vermont is really at the forefront of healthcare reform. We're moving to a single payer system. We've also fully embraced a lot of the pieces of the Affordable Care Act. We're also focusing a lot more on population health. So as I mentioned before, we have a statewide accountable care organization that we are the lead organization in. So we're really focused on taking care of populations of people. And that really has kind of made us shift our thinking in our role as a hospital. So in addition to taking care of people who are sick and who are ill and who are dealing with some very, very trying issues in their medical and their health life, we're also trying to raise consciousness of the importance of wellness, not only to our employees through our incredible workplace wellness program, which I do want to give a shout out to. They're an amazing team, but also to our patients and to our community. And really our opportunity is to inspire action, to inspire behavior change. And we can do that because we can really speak from a position of authority. We have a number of incredible experts on our team who can help people, depending on the area of wellness they're interested in, really help them work on that. But how do we engage people to pay attention and make change? Behavior change is hard. It's not fun. It's not sexy. You know, it's difficult work. I knew this from my own life when I had to lose 30 pounds. That was kind of an onerous task for me, and I wasn't really super excited about it. I knew I had to do it, but it was a challenge. So what we wanted to do was really rethink how we talk to people about wellness and really reframe the conversation. And instead of telling people what to do and being very prescriptive, Make it a fun experience, make it an engaging experience, and talk to people where they're already talking. And social media ended up being a great place to do that. 72% of Americans use social media, according to the Pew Internet statistics. More so, 42% of people actually search out social media when they're looking for wellness-related information. So diet, exercise, stress management, sleep, even career and social connectivity aspects of wellness. And most importantly, 1 in 6 minutes is spent online on Facebook. And that was really the most compelling one for us. We do have an incredibly vibrant Facebook community for our hospital where our employees, our patients, and our community connect and share information. So using just that kernel of information, we knew that Facebook and social media would be an awesome communications vehicle for our programs. This is moving without me telling it to, just so you know. So I'm going to try to do this. Also, Fitspiration is trending on social media. So for those of you who are on Pinterest, on Instagram, these are just some images I pulled up from doing a quick search, but there are tons of conversations happening about being well and how we can get better. Oops, there we go. And also on Facebook as well. So we see a lot of conversation happening here from health consumers. We don't see as much conversation happening from hospitals and medical authorities. So we really saw this as an opportunity to be the expert clinical voice who is part of the wellness conversation. So what did we decide to do? We decided to launch what we call the Healthy New You Facebook campaign. So this was a 4-week campaign that we launched at the beginning of the 2014 in January. We leveraged the anxiety people have around New Year's resolutions and goal setting and the change of the year. And we thought, what a great opportunity to talk to people about small ways they can make change in their own lives when it comes to wellness. Really break down their resolutions into easy, actionable things. So the insights that really drove this campaign were the fact that resolutions are simply more sustainable when they're shared. If I share with a friend of mine, look, I'm looking to lose 10 pounds. Just by that sharing, I'm creating an accountability. And that's really amplified in the Facebook environment. So if I share with my friends on Facebook, 500 friends that I have, I'm sure most of you have more than that, that gets amplified and people start to become part of that conversation. And finally, we really thought that how cool would it be to see individual participation in our campaign, create a system where wellness goes viral. How cool would that be? Imagine what could happen if we had multiple wellness moments that people were sharing online in the Facebook environment. And this is just an example when I shared my own wellness story. And you can see I got a couple likes, got a couple comments. More importantly, I got 3 shares. So those shares, were diffused throughout the social networks of the people who shared them. I know it's not a huge number, but you can imagine 100 people who share their story, who then have it shared multiple times. Imagine the effect of that. That's a real cool way to have peer influence happening. So what were the nuts and bolts of our program? So as I mentioned, this was a 4-week, month-long experience. So it was a fixed-term experience and campaign. We published content on a daily basis. So 3 to 5 times a day, we published on our Facebook brand page. The content had a theme every day of the week. So we had Motivation Monday, which was all about inspiration and getting excited about getting healthy. We had Tasty Tuesday, which was all about eating right, fun recipes, food, really cool stuff from our dietitians. We also had Wicked Wednesday, which, for people on the East Coast is kind of a fun one, where we told people how they could switch out a bad behavior for a good behavior. So for example, if you eat a bag of chips during your favorite TV show, maybe having carrots instead. So simple things. Then we had Thirsty Thursday, which we thought was kind of a fun twist on traditionally what we think of as Thirsty Thursday. And this was all about being smart about the beverages you drink. Fit Friday was all about physical fitness, obviously. Social Saturday was all about social connectivity and friendship and volunteering and being a part of your community. And then finally, Soothing Sunday was all about stress management, sleep, and really taking care of yourself and taking time out for yourself. So as you can see through those 5 themes, or those weekly themes, rather, we really wanted to hit all 5 aspects of well-being. This wasn't just about fitness, hitting the gym. This wasn't just about changing your diet up. It was really about thinking holistically about your wellness. It also was a very low-effort campaign. So oftentimes when we think of New Year's resolutions, we think of big goals. And big goals can be really hard to tackle. So we really wanted to help our community online break down those aspects of their resolutions. So each tip that we posted on those days of the week was a really small thing that a person could do to change their behavior. In addition to that, engaging was also very simple. All you had to do was like, comment, or share, post a healthy selfie, or check in at a health-related location to then be entered in the contest aspect of this, which I'll talk about in a second. And for participating at that level, there were rewards for action. So we did have a daily prize. We had a financial incentive. It was a $10 gift card to Dick's Sporting Goods so that you could buy something to get you on your wellness mission. And we also had 2 grand prizes, which were $500 gift cards to Dick's Sporting Goods for an employee and for a community member. So the financial incentive actually ended up being a very powerful way to get people to engage with us initially and then click through and really learn more about how they could be healthy. So here's just one example of, and you can see from this how creatively graphic this was and how we really were very thoughtful about how this would show up in the Facebook environment. As we know, photos perform the best out of all Facebook content, and behind that is video. So we really wanted to make this a very visually focused campaign, and I'll share some more graphics in a second. But again, this was Wicked Wednesday, and again, small thing, you know, if you like dessert, you like sweets, don't give them up, just figure out a healthier way to integrate them into your life. And this actually clicks through to content on our blog and a blog post from one of our nutritionists. So throughout this campaign, we want to link people back to our branded content. And that primarily lived on our blog. And that was where they could get information from an expert resource from our organization. We also used videos, fun photos. We reposted people's healthy selfies, which was really fun. And we also picked up on internet memes, which was kind of dangerous territory for a hospital, but we figured we would test it out anyhow. And here are just some examples of that. We really wanted this to be fun. Like when it's Facebook, it's fun, it's human conversation, it can't be boring. So what was really critical to us was to really pick up on some fun trends that would get people engaged. So you can see here, we kind of did a riff on the Some E-cards. We played up on the meme with the baby and the panda. We posted the inspirational quotes, which are very, very popular, as you know from probably Pinterest, but also really popular on Facebook. And people love this stuff. They ate this up. They liked it. They engaged with it. They really enjoyed it. And it was a great way to get people to actually link through to meaningful content. So it was a good conversation starter to get people linked through to content that would actually help them change their health and change their behaviors. So at the end of the campaign, for us, this was really wonderful. We generated 1 million impressions in a 4-week period. We were able to increase the size of our Facebook community by 10%, and we saw a very, very minimal drop-off rate. So the people who stayed with us during the 4 weeks of the campaign and who joined our page have stayed with our community, which is really great because we're able to keep sharing wonderful health information with them. We also saw 219% growth in engagement. And for those of you who manage a Facebook page for a brand, you probably know that Facebook has really become a pay-to-play space. So to see engagement numbers that high is really fantastic when we consider how Facebook is changing. We also saw a 320% increase in web traffic to our branded website and our blog. And again, that's really great for people who are searching for health information online to be connecting with our brand and our experts. And more so, we saw an incredible outpouring of personal wellness stories. People were really sharing, engaging in conversation. What was really cool about this is that we just weren't putting out messaging. We were actually watching the conversation thread. Our nurses, our wellness coaches were chiming in on conversation. Community was really being built throughout this process. People were asking questions. So it was a really dynamic experience. And we got a lot of really wonderful stories that we've actually followed up on and shared with our community post this campaign. Here you can see our employees as advocates, again, getting back to the idea of viral wellness. Here's a woman from our orthopedic specialty center who posted about doing sit-ups at the office. Here's someone who just got a Fitbit, you know, is going to start tracking her activities and food intake and diet planning. We saw tons of this, which was really great when, again, you consider diffusing information throughout the social network. Our community partners also got in on the act. The Vermont Department of Health Tobacco Cessation Program ended up sharing our content. The Intervale Food Hub, which is a local food organization we work with, shared our content. So again, we were seeing a lot of really great sharing outside of our Facebook page. And more so, the participant feedback was just incredible. You can see here they could trust the information. It was an amazing motivator. They were so happy that an employer was encouraging healthy habits. A real sense of community was built. The giveaways were a bonus, but the advice was well worth looking for, so people were finding value in both, even though the carrot was the financial incentive. People love the sarcastic spin, which is really great for us to hear because we really went out on a limb to do that. And people will be watching for it again. And I'll show you in a few slides. We actually did do this again. It's been a super successful tactic for us to connect with our community. Getting back to behavior change, we're still measuring this, but I thought that I would just bring in some verbatims for you guys to see. Right now, the data is very qualitative. We're looking to make it a more quantitative, put in some more metrics as we do this in the future. But you can see here, people added in running to the weekly workout, changed their food regimen. This person switched out kale for regular salad. Kale is huge in Vermont, by the way, so that was pretty exciting for us. So we saw little things like this every day. And again, the focus was on the little things you can do to be healthy. So we saw people doing these little things. We celebrated those. And we hopefully helped them accomplish some more of those as they went forward with the contest. Subsequent to this, am I on time? We did a heart campaign. We also did a June Jumpstart campaign in summer, leading up to the summer, the first day of summer. And you can see here just some of our metrics. Our June Jumpstart has actually been our most successful campaign because we did tweak the campaign that we ran in January to make our June one even more successful. And you can see here the numbers are awesome. 3.9 million impressions for a June Jumpstart. For us in Vermont, that's awesome. We also started surveying people. So you can see here just some surveys around behavior change. And then finally picked up some best practice. So incentives really working, creativity being critical, keeping it simple to engage being really important, tapping into the expertise of our organization and showcasing our people, and making it sustainable by using paid, owned, and earned media. So what's next for us is that we're going to be running a nutrition campaign actually starting next week. That's actually modeled after this campaign. We're also going to be testing out some different Facebook groups for ongoing community engagement with people who participate in our wellness programs. So that's my show. If you have questions, I'm happy to entertain them. If you'd like to be in touch with me, here is my contact points. If you forget what I look like, that's what I look like. And I'm happy to open it up for questions if there are any. Okay.
And in that role, we have certainly had involvement with social media.
Mm-hmm.
Early on, we even had a MySpace page. Our involvement is. And then we had a Facebook page that was fairly active until the day that somebody threatened to commit suicide on the page and posted that as a post or a comment on our page.
Mm-hmm.
We caught that comment in time to contact the physician of the person involved and have them helped and offer help to them. And it ended well. But that was scary enough to us that we made our Facebook page a business page that didn't involve comment, which of course shut down the effectiveness of it. So I had two questions for you. I mean, in terms of risk management, obviously that's part of my question, but also in terms of daily management. Who does the posts? Who do you partner with? Who watches it for people who are posting comments that need attention, maybe not as dramatic as ours?
Yeah.
And I also wanted to ask about Twitter and your use of it.
Okay, sure. So to tackle the Facebook question first, so I am the full-time community manager for all of our properties. So we are on Facebook, Twitter, LinkedIn, Google+, which no one else is on, but we're on anyhow, Pinterest, Instagram, YouTube, and probably another one that I forgot. But so my full-time job is to strategize and manage all those properties. So I am actually looking at those all day long for comments. So it's very, very important to have a community manager who's actively watching. We've never had a comment like that before, but we have had patients reach out to us with very specific questions about their experience or, pre, during, or post being at the hospital. So it's been really important for us to be vigilant. Also, when I started working at Fletcher Allen, my primary goal was to create a content network across our organization because I'm only one person. So I need to harvest the stories from our entire organization. I need to know people across the organization. So I met with our patient and family advocacy team. I met with different segments of our medical staff and really built a great network of people who I can reach out to on a daily basis when questions come up, whether that's what's the room service menu or whether that's a much more serious case. We actually had a situation where we had a patient who was autistic, who felt they were being mistreated by the hospital. and actually got a number of people from their community to start posting on our page as well. And our page is totally open. We want people to be able to comment and share, and we take all kinds of feedback, negative or positive. But we do have some rules and guidelines that really talk about if you are seeking medical advice, here's where to do it. And as soon as we do get an issue like that, we escalate it immediately and take the conversation offline. But that kind of situation hasn't precluded us from keeping our page open, because that conversation is going to happen online no matter what. And honestly, I'd rather it happen on our page so that we can help that person than have it happen somewhere else where we don't know about it. So we really want to be an open resource, and we want to tackle those hard questions, even though it can be scary sometimes for people because of the immediacy of it. Our use of Twitter, does that answer the Facebook question a little bit? Okay. Our use of Twitter, in Vermont, Twitter is not a huge consumer tool, but it is a huge tool for media and for politicians and legislators and members of government, who we have a lot of partnerships with. So we primarily use it as a news sharing channel. We do handle some patient questions on there, and we do get them from time to time, but the volume is quite low. So we primarily handle it as a tool for sharing news and for sharing information from our blog, and for really connecting with the media. And it's been a really awesome tool for that. We've actually gotten a lot of great media stories from using Twitter and tweeting out, information from our blog. So it's been a great, actually, it's really helped our PR team a lot. So does that answer the question about Twitter?
Thanks.
Okay. Yep.
I think you also there are programs that will update you through your email when comments are posted.
Yeah.
Like Discus, which can help you in one central location to sort through the comments, so you're not having to go through everything.
Yeah, so it's a great point. So we use Sprout Social to do content management. However, I've used Radian 6 before. They're a great tool, not only for social media management, but also for conversation trend data analysis. We're actually piloting a work with Reputation.com next year to manage physician reviews on sites like HealthGrades, Vitals, this panoply of different review sites that are out there. Okay, that's fine. Thank you.